overview. Yes, could you ask the first question?
I have a comment. My name is Wendy Johnson, Askew, and I am with Gerber, and we do the Feeding Infant and Toddler Study, which we did in 2002, 2008, and we're in the field with one now. Each survey is a cross-sectional survey, and each one has about 3,300 odd infants and toddlers that we are measuring. And our findings on fruit and vegetable intake are very different from the findings that you just presented. As a matter of fact, we find that most young children are not getting a discrete serving of vegetable at any day. So I don't know whether there was a difference in the methodology. As a matter of fact, the results from the 2008 study were used to help to influence the change in the WIC food package because there was not enough vegetable consumption. So we are really struggling trying to find ways to provide more vegetables in a stealth way to babies and toddlers so we can get that number up. So I would love to know what some of the data sources. Maybe we can talk offline, or maybe I can share our data sources with you.
Yeah, so I'll just say quickly, this is in Haines data. I'll say that the data that is used includes like mixed dishes or so the component of the mixed dish that was vegetable would be included. In terms of juice, and I meant to mention this, that data includes 100% fruit juice, and so that's how juice is handled would be important to look at. Yeah,
fruit is not as much of an issue. The vegetable piece, the sat fat is high, the sodium is high, so they have their diets actually mimic those of adults. So if there was another study that was done actually reported in pediatrics that was done out of CDC, which showed very similar patterns to what we found, and it was longitudinal, so they showed that those patterns that were established in childhood lasted through the age of 6. Now, based on looking at what we found from FITS and looking at the NHANES adult data, I would dare say it tracks all the way through adulthood. So we've got to get to them early.
Thank you. A very good question. Any other? Let me go back to Haines for a minute and just, go ahead. Go ahead, Nancy, you speak first.
Nancy Rosado. Looking at this from the lens of flavor perception, so people don't like the taste of vegetables. They detect the bitterness, they don't like the smell of broccoli when you cook it, right?
Not even ex-President Bush liked it.
Right. And, we could argue about ketchup, but, so I think that aspect, and it's very interesting to hear that it's really the vegetable issue across the lifespan that we need to address. And I think your point about finding ways of incorporating vegetables in a way that creates flavor profiles that people are willing to embrace is really a big challenge for everybody. And it's not just telling people to eat your vegetables. People aren't going to just eat their vegetables if they do not like the taste and the smell.
So I'll just comment, another analysis that was done for the dietary guidelines looked at what are the top sources of calories, and one of the top source, which isn't that surprising, was mixed dishes. And so there are strategies that are recommended in the guidelines that, exactly, I mean, it's not necessarily take broccoli everywhere. It's, incorporating different vegetables into the mixed dishes that you are consuming. It can be as a component of the way people are already eating. It's, using less cheese, adding more vegetables. I mean, so I do think that's a part of the conversation around the strategy to actually accomplish it.
Yeah, and I think that's great. I think, more that can be done in that direction. That's the way that we have to go. So,
thank you, Nancy. Great question. Thinking about Haines data again, as I remember, if you look at it, if you get to people over 75 or 80, almost all of them have at least one chronic disease, maybe two. They have a whole bunch of other problems. About 60% of them take some kind of dietary supplement. About half of them probably are taking multivites or more. So some of the assumptions that underlie the dietary guidelines for very old adults seem to be different than the assumptions for younger people. And I wondered, going back to this notion that you mentioned, that very nice slide you had at the end, where you talked about some of the similarities and differences, whether you think it is time to do a I don't know what it would be. It would be a 75 to 90 dietary guideline.
I think it's worth talking about. I mean, thinking about what are those stages of life? Are there certain stages of life where, one, healthy eating patterns are particularly critical, you know, at different stages, and also if there are these populations that really need tailored guidance, doing more to get to that tailored guidance. I think that the dietary guidelines, they cover a broad spectrum of ages, and we can do focused attention on certain age groups. We have done it to a certain extent over time, but is this now the time? Is there the evidence base? Is there enough topics to really do some focused guidance? You know, we are doing it for birth to 24. We have had guidance around pregnancy in the past, but doing more comprehensive guidance on pregnancy, I think it makes a lot of sense to look at some other stages of life, and older adults are probably one of them.
Good point. Dr. Weimer.
Yeah, thank you, Eve. This was a great presentation. And particularly, I'd not seen the slides showing the gaps in the different, laid out by the age ranges before, so that was very interesting. So I have a question and a comment. I feel like the dietary guidelines are great. They're great for a framework and knowing what we need to do and guiding our population directionally where they need to go. But as I think about it, where I see some gaps, or where I think there could be gaps, my question is then, how can we as nutrition people address this? Is there still seems to be a lack of understanding within the population of some of the very basics to even understand. When I see cup equivalents, we all know what that is. For them, it's just not a simple message. And I think the plate is great because it's a great visual, but I still think there's a gap in helping consumers really understand what does that really mean? I mean, what is a cup equivalent, or, whole grains and whole grains equivalents? So I think that there are some of those things that I don't feel like we've maybe quite made the leap in how we can help consumers get there. So I just would appreciate your comments on that.
I agree, and I think it is the messages around what that really means, I think, depends on the particular age group of people you're talking to. So, for example, the National Institutes on Aging have talked about the amounts, cup equivalents, in ways that are relevant to an older adult population. And I think we need to do, that's an implementation piece. We have this piece now working with your particular target audience of adolescents, how to talk about that the amounts in a way that is relevant to them, I think is important. I also think in terms of the population perspective, it is amazing. We all know this. The stories that we see in media every day, I think I understand the population's confusion around what are the components of the diet and how much, because every day it feels like they hear something else. And so there is that voice, and I think having a more collective voice across the nutrition community to talk about what is a healthy diet is important too. So I think there's a level of doing implementation within the relevant target audiences, but also we need to collaborate and communicate a healthy diet through a bigger lens, because the public is getting so much different information, not necessarily misinformation, but just different information every day from different sources.
Thank you. Any last questions? Okay, well, thank you very much, Eve. Why don't you go where you can see the slides, and we'll get you up later. Thank you very much.